The healthcare industry makes trillions of dollars each year. But if the system worked, why are so many people still sick? So let's talk about the business of sickness and why profit drives the industry. If you're new to my channel, my name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to. Welcome to my channel. If you're interested in all things holistic medicine, you've come to the right place. Please consider joining our Intro to Holistic Medicine class. It's completely free, also includes a community of like-minded holistic health seekers, all sharing and educating and just really, building a community of love and peace and holistic medicine. All right, so let's talk about this profit-centered system that we're part of. So first off, 80% of healthcare spending is on chronic disease, right? And so chronic disease, it's not the pandemics and it's not all that. It's not the reactive, it's not cancer, it's not any of those things. It's actually more of our chronic lifestyle modifiable factors, which means they're preventable, which means that if people have the proper public health education and the wherewithal, right, access to food, access to healthy water, all these things, then they could be able to prevent this particular disease. Unfortunately, there's so much misinformation, so much confusion about what it means to be healthy, how to be healthy, et cetera. And that is all done on purpose. Pharmaceutical companies often prioritize lifelong customers, so there's no money in curing the disease. And so they will often omit information or create a lot of confusion. I know there's a lot of stigmas and stereotypes, like holistic doctors like me. We don't know science, we're unscientific, we're just woo woo, when it couldn't be further from the truth. So it's never been about the science, it's always been about the money and the profits that they generate. So doctors, conventional doctors, are trained to prescribe. They're not trained to prevent disease, reverse disease, or even stabilize disease because medical school education is funded by Big Pharma, unfortunately. So while they may think that they are not complicit to the system, if they have gone through the conventional medical school education, they are on some level complicit, just simply because they have agreed with this Rockefeller system. And so that's why I just am not a proponent of going into the Rockefeller system because for me, it would have been conflicting to my belief system and really my integrity and my values. Even though medical doctors are much more respected in the healthcare community than holistic doctors. We get called names on a daily basis. We get put down, we get judged, we get deemed. Really, it's just a symptom of the billions of dollars that pharmaceutical companies spend to discredit doctors like me. Also, too, they've built this pretty inaccessible insurance system. And so the insurance system, Thomas Edison said the doctor of the future will give no medications, but will interest his patients on diet, the human frame, et cetera, et cetera, et cetera. You can look up the quote. And so he said that when the first HMO began, because insurance really, again, is more of a profit center. You're paying into a system, and then when you need to go use it, they're like, oops, you can't use it, right? So you're paying hundreds of thousands of dollars every single month, every single year for service for a what if, right? And so I tend to recommend patients, if they are choosing a holistic lifestyle, to go into a more catastrophic plan, something that's more high deductible, offset the rest of that money into an HSA account, which is a health spending account, and then they have more freedom and flexibility in terms of where they can use it, such as with a holistic doctor, et cetera. While most insurance covers medications, not every insurance company will cover holistic health services. Some do, some don't. But even still, the insurance-based model is not really proactive. It's very reactive. It's there for the just in case. It's not there. Your car insurance was not there to, get your tires, to get your oil changed, to do your 10,000 mile servicing. That was not what your, car insurance is designed for. It's designed, if you get into a car accident, it's there. Same thing with the health insurance. Unfortunately, though, because it's personal to us, we tend to be a little bit more or a little less rational when it comes to our health insurance, but it's in essence supposed to work the same as our car insurance, right? So Oftentimes holistic providers, we charge, right? I try to be, cost conservative, while at the same time, valuing professionals education, their experience, etc. So again, if you need to learn something, if you need to expand something, you're going to have to invest in yourself. So if you're tired of being trapped in this cycle of symptom management, if you're tired of wasting money on copays, you're tired of going to every single doctor underneath the sun, you've been to your primary, you've been to all the specialists, you're still not getting answers, you're getting medically gaslit, you're being told the wrong thing, you have this just intuition that says that this is not right, you may have stumbled upon this video for the right reasons. So it's time to make a change with your health and how you approach your health. So first things first is through education, right? That's how I operate. So, first thing I would recommend is attending our Intro to Holistic Medicine course. You can register simply by clicking the link in the bio, filling out the form, and then away we go. And so, it's a 12-week course. Every single week, you're going to get, various different lessons, about holistic health. And it's really cool. It's actionable. So, there's going to be some health markers we're going to look at. We're going to look at health data. We'll look at one subjective marker. We'll look at several objective ones. So, your pH levels and your heart rate. And we're really going to bring this world of holistic medicine to life for you. So if that's something of interest to you, definitely check out the link in the bio and like, share, subscribe for more.